Yeah, let's get right to cardiologist Dr. Steven Sinatra. No relation. We want to talk about the effects on this president specifically over other world leaders who have contracted the virus, doctor. Because as we know, President Trump is considered obese by health guidelines. He also is of an advanced age. Are these things that we need to worry about him being more affected, or as we move forward?
Oh, yeah, absolutely. An aging male is at high risk. Diabetes is also at high risk. I mean, the overweight status certainly is or any insulin resistant diabetic situation. But the president has two positive variables, the way I see it. He doesn't drink alcohol, and basically he doesn't smoke. So, the coronavirus, when it locks into the ACE2 receptor in the lung, having a healthier lung going forward is really crucial. And the fact that he doesn't drink alcohol, having a healthy liver, which is a major organ of detoxification, is also crucial. Well, I'm a little optimistic for the president.
Well, that's certainly some good news, as all of us here, well, a lot of us here certainly wishing the president well. I wanted to, not to put you on the spot, but I'm reading through one of the releases from the White House within the last couple hours, and they say he's received a single 8-gram dose of Regeneron's polyclonal antibody cocktail. What is an antibody cocktail?
It's an antibody to help counteract the antigens of the virus, but unfortunately, as a board-certified cardiologist, I'm not an immunologist, so that's out of my area of expertise. I will let others comment on that.
Okay.
Well, I know that this is an experimental drug. It sounds like we don't know much about it at this particular time. Is that true?
Again, I don't know the answer to that question. I'm so sorry. I mean, I can
Dr.
comment on vitamin D, for example, or minerals or melatonin. I mean, I understand he takes some of those nutraceuticals, which I strongly endorse, by the way. I think vitamin D is one of the most important vitamins you can absolutely take in the prevention of any complications of this virus, including death. There's been some really good recent studies on vitamin D. And as a vitamin D expert for years, I highly endorse the fact that anyone in the country take at least a couple of thousand units of vitamin D a day.
That's good to hear because I'm on 5,000 IUBs a day, so I'm right there with you.
That's good. You're in good shape. If your blood level is between 40 and 60, the data shows, even if it's 30 to 35, the mortality is zero on a small study of several hundred patients. So that's pretty good news to really lock your teeth into.
Yeah. Let me ask you about the president's, direct inner circle. Mark Meadows, his chief of staff, came out and addressed reporters this morning without wearing a mask because he said he tested negative for the coronavirus this morning. But doesn't that mean he's not necessarily negative because the incubation period can be up to 14 days?
Correct. Yeah. I mean, usually a lot of these people can develop the virus within 2 to 3 days. But again, I've been a doctor for almost 50 years, and certain laboratory tests you can really, sink your teeth into because you believe them wholeheartedly. The problem with the testing, though, it has a lot of false positives and negatives. So again, I mean, clinical symptoms rule here. So if the president develops fever, has lost a taste or smell, has muscle myalgias, things like that, clinically he has the illness. But again, I wouldn't base it on the laboratory report at this point.
Yeah, he's been airlifted to Walter Reed, and they do say he has a low-grade fever. They've mentioned even some chills that the president's been experiencing. It makes me nervous when I hear the president of the United States entering a hospital. The White House initially said for precautionary reasons, though they now say he might be there a few days. Is there any read into that, or is this being overly cautious for the commander-in-chief?
Great question. I think it's overly cautious. I remember working at St. Francis Hospital in Hartford, Connecticut as an intern resident and a cardiology fellow. And I never knew it, but when the Archbishop was, admitted there with a cardiac problem, and I saw him on a floor I didn't even know existed. It was like the Taj Mahal. It had, it was beautiful. It was like being in a Manhattan hotel. So I don't know what Walter Reed has. I'm sure they have a great facility. I'm sure they have great air filtration systems going on there, as well as healthy waters, and it's nice and clean. So with the president being in Walter Reed, I think he's in good shape there.
And now that he has just arrived there, what do you think his physicians would be doing right now?
Basically just supporting him, getting more laboratory data, checking his liver function, checking respiratory function, getting some tests baseline tests to make sure that if he does crash, they can assess his reserves, assess his status right now. And again, if he has a healthy lung and a healthy liver, if he has no history of asthma, for example, or his liver's in great shape, I'm optimistic for him. I really am.
Well, and I would say, doctor, and you can, correct me if I'm wrong here, but the fact that he walked out to Marine One and got on his own is a really good sign that his lungs are working well.
Sure, it's a good sign. It's interesting. I've spoken to doctors who, new doctors in Milan, Italy, where 100 doctors died of coronavirus. And I'll tell you, what they told me, the profound weakness of this virus, where you're standing 1 minute and the next minute you crash, is just amazing. And I think a lot of it has to do with respiratory function. So again, I think he's in a good place. And I think with his robust nature, like I said, I'm the same age as him. I mean, I almost went to the same high school. And I have to tell you, at 74, he's in great shape. So I think the fact that the stamina he has and the reframe for the president and the nation is this. I mean, his schedule is frightening. I mean, I can't imagine somebody going through that schedule. So the reframe here, as the commander-in-chief of almost the whole world, now he has an opportunity to rest. And rest and relaxation are key right now. I think this is so important as a healing modality. So the reframe of this is going to give him the rest this man desperately needs.
Fantastic. Dr. Sinatra, thank you so much for your thoughts on this. And it's good to hear that everyone thinks he's going to do well. For more information on the doctor, you can find him at drsinatra.com and, of course, on social media as well. John.